Good morning, good afternoon, and good evening to everyone watching us all over the world. Welcome to the Policy Advocacy on Genetics and Genomics course 2025, February cohort under the PAPERI initiative. My name is Patricia Kinywa. Waruguru from Kenya, and I'll be joined with my colleague Joel Nikupala from Tanzania. So we are group 3, where we are against the making premarital genetic screening mandatory in African countries, as the topic suggests. A bit of the introduction, just to dissect the topic. Premarital genetic screening is a process where couples undergo genetic tests to identify if they are carriers of shared genetic mutations that could be passed on to future children. So in Africa, 75% of the 75% of the global burden, there is 75% of global burden in sickle cell disease, and to some extent thalassemia as well. The United Arabs are one of the countries that have implemented genetic testing before and within marriage. So as an opening statement, we oppose genetic testing to be a mandatory part of premarital screening because of the following reasons, just as listed. It violates medical ethics, particularly autonomy and confidentiality. It really conflicts with our cultural and religious diversities. It is going to create financial and logistical burden to the African healthcare system. It's going to increase social discrimination and stigmatization, that it will lead to unintended harm. So there are better ways of going about genetic screening, such as voluntary testing, improving the healthcare system, and implementing education awareness for the people and the audience to know. So on to the constructive arguments. Autonomy, as one of the principles in the medical ethics field, forcing genetic testing removes that right for anyone to make free choice, independent choice on if they want to take the genetic test or not. Confidentiality risk. If the results are disclosed, of course, individuals may face discrimination in marriage, employment, or insurance. So a positive test might not remain private as we intend it to be. Some of the medical personnel may be tempted, and so confidentiality may be breached, and it will lead to family pressures. So a study done in 2023 showed that genetic information leaks can cause a lot of discrimination. Limitations of premarital genetic screening due to the cost that we cannot, as an African continent, we cannot afford to test for all genetic diseases. We can majorly focus on what is common, such as sickle cell disease and thalassemia. So you might give results to a couple, giving them false reassurance. They may think that they're safe from any genetic disease, but it's because the rare ones have not been detected from them. Also, there is limitation to prospect life partners. You might end up not experiencing love because you've broken up, because you are not compatible in regards to genetic makeup, because you're both carriers for a hereditary disease. Falsification of medical certificates. Because of the non-compliance regulations that are going to be implemented, many of the couples will end up going to the black market so that they can take fake certificates. And is this really going to help prevent any diseases? No, it will not. In the US, according to the point of stigmatization and discrimination, sorry about that, the US formed an initiative, Genetic Information Non-Discrimination Act, GINA, that safeguards the individual from being from insurers who might deny them coverage or also increase the premiums for them. So in an African setup, ideally, you'll end up seeing that once they realize that you have a genetic predisposition or you have a genetic disease, they will increase your premium, or they might also deny you coverage. So is that really going to create a problem or solve a problem? Those are the questions we need to ask ourselves. Another argument is that genetic testing is not incorporated as an essential healthcare benefit package for primary healthcare. we are going through a lot. And so we're going through infectious diseases, neglected diseases, vector-borne and waterborne. So these are essential diseases, I will put it, that have already have an economic impact. So when you add in genetic testing as a mandatory thing, you're going to burden the health system of our African countries. Also, we are Africans who focus more and who are really staunch on cultural and religious beliefs. And some religions still support cousin marriages, and so they might end up rejecting interventions in marriage decisions. So mandatory testing might end up facing resistance. And in some country, some of the couples, 90%, will know that they are at risk of getting a hereditary disease, but still get married. So has that actually changed anything? Yeah, food for thought. And now I'll let my colleague continue.
Taking over on constructive argument, there are several studies conducted in Africa indicating the gap in genetic testing. Some of them include covered Cameroon, Ghana, and Tanzania, indicating the complex cultural, ethical, religious, and social dynamic surrounding genetic testing that covered in area of sickle cell disease, and highlighting the need for public health education to cover up the ongoing gap in genetic testing. Next. Another issue is about opportunity and the barriers in genetic testing that was conducted in Kenya. And also this one highlights presence of burden in terms of cost of service and inadequate of infrastructure, highlighting the same point that were covered by my colleague. Going ahead to rebuttal part, the first one is preventing genetic disorders. The affirmative team proposed mandatory testing screening to prevent genetic disorder. However, this approach faces challenges in effectiveness and effects. Mandatory testing would overwhelm government emergence due to their cost and lead to possible falsification of certificate, and that result into failure to achieve an overall plan of preventing genetic disorder. Also, issues of cultural diversity, religious diversity, and other issues related to marriage doctrine difference in different areas of Africa will hinder the overall plan of preventing genetic disorders and the implementation of mandatory genetic screening. Another issue is economic and healthcare burden reduction. Mandatory genetic screening is costly, and as it will involve more implementation, investment in labs, staffing, and logistics across Africa. So the overall burden will be high, and we're not expecting to reduce the burden in implementation of mandatory genetic testing. And also we have seen the success in implementation of voluntary genetic screening in area like Nigeria, Egypt, and Ghana through implementation of sickle cell disease reduction. So we believe through voluntary genetic testing, we'll be able to reduce the burden and reduce the overall cost of healthcare. Next. Empowering couples with knowledge and informed choices. Unfavored genetic testing can deeply affect couples' psychology. Even with the information, couples may not afford alternative or medicine due to the financial and infrastructure limits. Also, in the area of psychology, couples may fail to access genetic counseling due to the scarcity of genetic counselor in Africa. So that may still hinder the achievement of the advantage of knowledge that will be obtained from the genetic testing plan. Next. Ethical and social responsibility. Mandatory genetic screening violates Article 9 of the Universal Declaration of Human Rights, which ensure the right of person autonomy and decision-making about health and reproduction. Although Article 25 guarantees the right of adequate medical care, it should not justify the violation of fundamental human rights. Mandatory premarital screening is impractical, harmful, and unethical. The approach must prioritize human lives in efforts to preventing genetic disorders. Next. As we close, we understand the goal of reduction of burden of hereditary condition in both is both admirable and necessary, but compulsory genetic testing raises profound ethical, social, practical concerns. Using hereditary disease is essential. Africa country must first address cultural acceptance, legal frameworks, infrastructure, and education before considering mandatory measures. Voluntary genetic screening should be prioritized, respecting individual rights and offering a more suitable and ethical approach to reduce hereditary diseases. So from our point of view, as TMF, we consider that it is too early and it won't produce the impactful result if African countries will start to implement mandatory premarital genetic testing. Thank you and welcome for any question.
We want to thank the PAPERI team, Dr. Wafa, Dr. Ernest, and Miriam for taking us through how to prepare this and for the course itself. Thank you.
Thank you very much.